Hey everyone, Dr. Eric Jackson here. Wanted to jump on and answer a fantastic question we received from Michael C. in one of our recent videos. Michael wrote, "Thanks for making these videos. I know it's not easy to do." Thank you, Michael. Do you think it would be possible to make a short video on gum health? I know when I think of the dentist, I usually think of teeth. However, I notice as I get older, my gums are receding, and I don't know if there are things I should be doing now or things I should have been doing when I was younger. What slows this phenomenon down and what would prevent it from happening? Thanks again. So, great question, Michael, first of all. A very broad, in-depth question. I mean, recession is tied to so many different things in dentistry, but it's number one thing that people really see. But often it's not the actual, it's not the cause. The recession is caused by something else. And so let's talk about that. What might cause recession? There's a lot of them. So we've got recession that can be caused by gum disease. We've got recession that can be caused by brushing too hard or using the wrong tools, like a coarse bristled toothbrush. We've got issues with recession when it comes to sports injuries. Trauma to the gums will cause it to heal differently and sometimes cause recession either in the short or the long term. A partial denture that's in somebody's mouth can cause recession because of the rubbing and the wear and tear, especially if it's ill-fitting. Genetics are something that is very important to consider. People just sometimes are genetically weak when it comes to dental enamel for teeth or gums for the gums recession. We want to make sure that we try to address our potential weaknesses when it comes to the cards we were dealt, and then play them properly. We'll talk about how to best address recession here in a minute. Other potential causes of recession are smoking and any kind of tobacco use. Putting a dip or chew is a very common cause of recession, and other issues, of course, cancer and whatnot. But it absolutely can cause recession. In addition, grinding and clenching, bruxism as we call it, in the more proper term, it often causes it because it's just making the teeth move back and forth in their sockets. And a mobile tooth, even on a micro level, can cause recession. How would we treat these types of recession? Well, the key, first of all, is figuring out what's the cause, right? Each of these is treated differently because each of them has a slightly different root cause that yields the common symptom or common condition of recession. So for patients that they're having recession based on gum disease, well, it's important to deal with the bacteria at and under the gum line, perhaps a deep cleaning, perhaps better home care and dental hygiene, perhaps more frequent visits to your dental hygienist. If that's the root cause, your hygienist and your dentist are going to be able to talk to you about best practices that you can enact to really help combat that. I'm a big believer in electric toothbrushes, which kind of bleeds into the other cause. Brushing too hard is a very common cause. Brushing with a toothbrush that's not a soft or extra soft bristle head is very common for people that just don't know the damage that a medium or coarse bristle brush can cause. They can absolutely cause a lot of damage, especially when you put a little bit back into it, and it causes that gum to recede right up the tooth. And unfortunately, it's only correctable with a couple different methods. It doesn't just grow back. We'll talk about gum grafting here towards the end. But using an electric brush eliminates the potential scrubbing because there is no scrubbing. This is a Sonicare toothbrush. I'm not sponsored by them, and I just love the product. When you use an electric toothbrush of any kind, there's only one button. You push the button, then you're able to go through and then be able to move the brush, much like your dental hygienist does with the polishing cup, over the teeth, and it does the work for you. There is no back and forth type scrubbing. That alone minimizes the chance of causing recession or exacerbating recession. In addition, all these bristle heads, they're all soft and made to make sure that they're gum friendly. They're not the kind that you'll find at the store that are labeled medium and coarse. Those, please don't use them. Those are good for, we'll joke, they're good for cleaning grout and other things, but not for cleaning your teeth. So we've covered gum disease, we've covered the brushing techniques. Dentures, partial dentures, are something that you have to make sure they fit properly. People often think that a partial denture, because it clips on, is something that's relatively foolproof. And while it can be very stable, often it has to be investigated and inspected by the dentist. And I recommend you do so every single time you get your teeth cleaned, and adjusted accordingly. The mouth is always changing. Those clips, those clasps are very strong on the teeth, and it can cause the teeth to move a little bit. It can cause the gums to move a little bit. Even if the partial is completely balanced and properly functioning, partials are rough on teeth. And so with time, that can cause some changes, and one of them can be recession. We talked about grinding and clenching. Grinding and clenching is something that puts a lot of extra stress on the teeth. It's so common, and it's really a root cause, or at least a contributory root cause of so many different dental maladies, including recession. But the solution is that if you have receding gum lines and you think that you're a grinder and clencher, well, then you should definitely look into a night guard. A night guard or an anti-bruxism device will keep your teeth from grinding against each other, and also give it a little bit of space so that way you're not over closing if you're a clencher. I think it's a very important aspect that historically people kind of kept separate. Oh, that's a tooth issue. Well, teeth issues and gum issues are often intertwined. So if you're going to be addressing recession and trying to correct the recession, then you're going to want to talk about a night guard perhaps, because ultimately we don't want the work to be ruined. So how do you correct recession? Well, you can stop the recession if it's an active process by enacting some of the practices we just talked about. But to actually correct it, you're going to have to start talking about gum grafting. Gum grafting, there's a variety of different methods. It's much too in-depth right now. Obviously, there's a whole specialty involved around gums and gum grafting called periodontics. A periodontist is a gum specialist who is a specialist in all the different types of gum grafting. Your general dentist may do some of the more minor type procedures, so ask him or her about it. But if it's outside of their realm, they might talk to you about going to see a gum specialist, and essentially where the recession is covered over. That's a type of gum grafting. Other ways of correcting recession are where the gum is pulled back down without adding new tissue to the area. So there's many different approaches. It's very specific to the case, and we're not going to get into it here, but all of them can work in different situations. I would always recommend talk to your periodontist, talk to your dentist about potential grinding and clenching, because I will always mention to my patients, if you're going to go through with the gum grafting, why would you not cure it and then at least protect it long term from grinding and clenching with a night guard? I think it's a very important thing with such a simple product. Night guards are great because they're relatively low cost, they are non-invasive, and they work. That's that triple play we talked about in the prior video. It's a great example of how this bleeds into other aspects of dentistry. Do you automatically need a night guard if you're going to get gum recession or gum grafting? The answer is no, not automatic. Nothing's ever automatic. But I want to put the bug in your head to at least talk to your dental provider about it and see if it's right for you. In addition, they're going to talk to you about how to clean your teeth, because if you're going there, they're going to talk about techniques and tips, much like we talked about with the Sonicare. So you can see how all this really is along the same vein, and then case by case, you're able to pick and choose and see which one's most applicable to you. Thank you very much, Michael, for the fantastic question. I hope this admittedly very brief summary wasn't too brief. There are obviously chapters and textbooks about each of these items but hopefully this will get some of the ideas out there. If you want to hear more, please continue to put comments in the section below, like the video, share it, and subscribe to the channel. It's always much appreciated. We love making these. I love making these, and it's just a really great time to be able to interact with patients. So thank you very much. Look forward to the next video. Take care. Bye-bye now.